Welcome back to American Medicine Today. Along with me is Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonatti. A Texas doctor is making headlines for his novel approach of treating COVID-19 by utilizing an aerosol steroid called Budesonide, normally used to treat asthma. His incredible success rate has some labeling this treatment a silver bullet for battling coronavirus. Please welcome Dr. Richard Bartlett, the man behind the discovery.
Well, I'm honored to be here today. Thank you.
So, Dr. Bartlett, tell us a little bit about your practice and just as a physician, how you responded when the news of the pandemic first hit. Then, how did you respond when you first started to see some of these COVID patients trickling into your facility?
You know, I've been on the front lines in primary care and also working in an emergency room, and that's been my practice for 28 years. And when we started seeing this disaster strike in January, I wasn't hearing any good news. I was only hearing that we don't have testing, that we don't have a treatment that's an option. And I was feeling overwhelmed along with everybody else in the United States as we watched the disaster unfold in China. And then it happened in Italy, and it rolled across Europe to France and Spain. In March, when I was working a 48-hour shift in the emergency room, I was distraught. I didn't know what I would do if someone came in with COVID, because I had just been watching daily the updates on COVID, and I was told that there is no treatment plan that's valid, that a treatment that President Trump had mentioned was shot down almost immediately in the next press conference. And on that, in that 48-hour shift, I had a strategy that I came upon, and it wasn't a week later that I was able to start using it on a couple, my first two patients in March. And since then, it has worked for every patient. My mortality rate is 0 with my treatment plan. Yesterday, I had 40 patients that reached out to me with COVID, and I am referring all of them to other providers that are using my same treatment protocol. And they're all having a mortality of 0. And we've been treating this since March. The reality is there are other healthcare providers that are saving lives with this strategy. And the strategy is, the keystone of the strategy is that COVID is a respiratory virus that attaches to the ACE receptors in the lungs and then triggers the release of inflammatory chemicals, cytokines, and also inflammatory enzymes and other inflammatory proteins that cause a cytokine storm that will cause multi-organ failure. And it's the multi-organ failure that's killing most of the people from COVID. They're having renal failure, they're having heart attacks, they're having clots in they're having DVTs and PEs and strokes, and of course, eventually ARDS. The whole problem is a new kind of killer. We've never had this type of killer before in the United States. And so when the strategy in the beginning was to treat it with ventilators and treat it as just a respiratory problem, you can see that was a failing strategy, and they've backed off of that because it's not like the flu. As far as the flu, the main cause of death with the flu, as everyone knows, is secondary bacterial pneumonia. In this case, we're having people die from acute renal failure, from heart attacks, from strokes, from pulmonary emboli, and ARDS eventually if they continue to survive everything else. And so it's inflammation is the issue. And so this strategy of using an inhaled budesonide, which has been out for over 20 years, is so safe that they've used it in the NICU on preemie 2-pound babies for over 20 years. And they use it on the fragile in the nursing homes without batting an eye. This is the keystone of the treatment.
And why do you think that the media hasn't really run with this story as they should to save all those individuals' lives?
Well, I believe that they're catching on. The interview that I did on America Can We Talk has 1.1 million views in 5 days. And there are government leaders that are reaching out to me that are responsible leaders. And I'll mention one that called me last night that reached out to me from Alaska. The state senator, Shelley Hughes, just met her last night. And so she brought my paper explaining the strategy and citing 51 references from well-respected journals over the last 20 years. She wanted that so she could present it to the governor and to their chief medical people for Alaska. And she did that this morning. Actually, she did it last night, and this morning she told me I already gave it to them and they're looking at it. And so wouldn't that be amazing if Alaska starts using this treatment plan and they open up their state and all of a sudden the mortality rate plummets to zero in Alaska and they lead the way for our nation out of this fog?
How did that first thought occur that this might work with this battling COVID? And secondly, to just jump off what you were just saying, a lot of the reason why it isn't so widespread now is it because it's not approved by the FDA for treatment specifically against COVID?
It is FDA approved to help people breathe. And so as an ER doctor, I actually am an advanced trauma life support instructor. So I teach trauma surgeons and ER doctors how to take care of trauma. And so with advanced cardiac life support, advanced trauma life support, CPR, we talk about ABCs, airway, breathing, circulation. The imminent concern back in March was breathing. And so this is FDA approved to help people breathe. There's 25 million asthma patients in the United States right now, and many of them have been using budesonide for decades. Mm-hmm. Inhaled steroids are the first line recommended step to protect people from asthma attacks, which can be life-threatening. And so you have toddlers and you have school-age kids that are being put on nebulizer treatments every day for decades with budesonide, and we've never heard a negative thing about that because there isn't anything negative to say. It actually saves lives and it helps people breathe.
Stay tuned for more after the short break.
A friend of mine, she told me about Barnett. He was the only one to address all 4 discs as quickly as possible. And if you're to that point where you can't take it anymore, like I was, do your research, find out who the best is, and get it done.
Barnett succeeds where others fail. World-renowned Dr. Barnett created the Barnett spine procedures to minimize surgery, scarring, and recovery. 60,000 procedures have resulted in 98.75% satisfaction. Over half our patients suffer from failed surgeries at other facilities. Barnett succeeds where others fail. Welcome back to American Medicine Today as we continue our discussion with Dr. Bartlett and his treatment for COVID-19. You're saying it saves that many lives, and it is something that's already in the marketplace, and it's at such a fractional cost for the patient. Am I right?
Yes, you're exactly right. It's generic. And so nobody's going to make a lot of money off of this. So when I have a patient reach out to me and say, I can't breathe, I'm interested in helping them breathe. And this actually was given to them, and I was shocked of what I was hearing when it was given to COVID. It was like it was made for COVID. You give it to people with asthma, and that's right, and that's correct, but you never hear a patient say, I feel better when I'm using budesonide if they have asthma, because they don't feel anything. Unfortunately, they don't get that positive feedback, so they many times will tell their provider, and every doctor knows what I'm talking about. You give generic budesonide to your patients and they will come back 2 months later and you ask them, how's it going? And they say, well, I stopped using it because it didn't work. And what they really meant is they didn't feel anything. It does work. They just don't feel it. But with COVID, they feel it. So they tell me, I can breathe. My shortness of breath is gone. My chest pain is gone. My cough stopped. And then as the medicine wears off, their cough comes back, their chest tightness comes back, and they get another treatment of budesonide, and it goes away again. But when I reverse engineered by doing research, I found the reason why it's working. A plethora of research has already been done for decades on this medicine against asthma and against inflammation, against SARS even. And it shows that it blocks the release of the interleukin 2, 3, 4, 5, 6, 11, 13, 15, SCF, GM-CSF, it blocks cyclooxygenase from being released. That's what all the anti-inflammatories, non-steroidal anti-inflammatories are against. If you think of ibuprofen, Aleve, Relafin, those are just against that one. There's at least 30 inflammatory chemicals released, and that's just one. And everybody knows how well ibuprofen works, but it's not the answer for COVID. Inhaled budesonide blocks the release of all of those, including thromboxanes. Thromboxanes are released, and that causes an increased clotting. And so that's why we're seeing people have heart attacks and strokes and pulmonary emboli and DVTs with COVID. And so this is a perfect overlay for the inflammatory chemicals that can be released from the lungs with COVID. Doing the research, I know why, and that's why I wrote this paper to document it and send it out. So I've had Senator Ted Cruz have his office reach out to me for a copy of my unpublished paper. I've had Senator U.S. Congressman Babin from Texas, the state senator Shelley Hughes from Alaska, and other state senators and state representatives that have reached out to me wanting this paper, and they all have it in their hands now. And I'm ready to turn the tide on this, and I'm seeing a zero mortality. And like I said, I've referred at least 40 people yesterday to other providers that are using this protocol, and we're all having a zero mortality. We're having everybody recover. That seems like good news, and that's why I'm on your show today.
You know what I find interesting is you said certain governors have reached out to you to take a look at your paper, but I don't hear California reaching out to you. I don't hear you talking about New York reaching out to you, where they're kind of the epicenter of this quote-unquote pandemic. Hopefully you can get your paper in front of President Donald Trump so that he can put this out there for the people, because they need to see that there is low-cost alternatives as opposed to the big push from Big Pharma. When they get hold of a medicine, they're putting products out there, and I don't remember the name of it, but it started off at almost $2,000 for one dose. And then within the same day, they said the price was going up between $3,000 and $5,000 a dose. And you're talking about something that is accessible to patients at minimal cost and reflects better and almost instantaneous results.
Has there been patients dying that have received other treatment strategies? The answer is yes.
Yes.
And unfortunately, those treatment strategies are not FDA approved either. There's no FDA approved treatment. So that's a ridiculous, frivolous, naysayer comment. And by the way, naysayers have a body count. My mortality rate is 0. And I'm going to send a message through your through your show right now. President Donald J. Trump, I respect you as the President of the United States, and I implore you to consider this treatment plan to save Americans' lives. With great respect, I submit that to you.
I really appreciate very much this new idea. Anything that can control this problem in the country is welcome. Seems to be that the results that you achieve are amazing. So good luck with it. It's very little comments that I can do except in appreciation for your dedication and the luck to be in the field that allows you to understand the problems on trauma and preferentially in the respiratory area that is compromising today with the COVID. So I admire you, sir.
And I admire you, and I would like to say, as a back surgeon, with your expertise and years of experience, you understand if there's a spine injury, we often give high doses of Decadron, do we not? Dexamethasone temporarily to protect the spine. That's a historical, factual treatment, correct?
That's correct.
And initially with COVID, we were told don't use a corticosteroid. Whatever you do, do not give a corticosteroid. That was the messaging to all doctors with COVID. But we found in the UK last month a study that shows using dexamethasone IV when patients are already at the end of the disease, they're on a ventilator in the hospital, a third better mortality, and that totally proved that the original strategy that they were giving us was wrong. So corticosteroids are the key, and budesonide seems to be very important. That's why the University of Oxford in the UK said they're going to study inhaled budesonide against COVID. And Queensland University in Australia announced the other day they're going to study inhaled budesonide against COVID in early treatment. Good for them. They're on the right track, and that's what I'm doing for my patients. And many other providers are using my protocol with zero mortality. And I have great confidence that we're going to turn this around in America.
What type of dosing? Is this something that's done within 5 treatments, 10? Is it something that they have to continue to do for quite some time?
For the patients that I see, when they're having their lips purple and they're short of breath and they have chest tightness and they're in imminent demise, in imminent distress, you can use 1 milligram immediately, and if they have the symptoms recur in 2 hours, you can do it again. For asthma, 1 milligram a day is what's approved for asthma. They don't have anything that's been studied or approved for COVID. But I just saw yesterday remdesivir, the antiviral that failed at treating hepatitis, that failed at treating HIV, that's now over $3,100 a regimen, plus you have to be in the hospital to get it, and you have to be a part of an experiment, has hepatotoxicity. That's the study, that's the report that came out yesterday in the medical news. This doesn't have hepatotoxicity. It is very safe. The fear of causing a secondary bacterial pneumonia is also down. So as far as the dosage, I'm telling you all that to help the doctors who are saying, well, you might set them up for an infection. What about IV steroids that turn down the whole immune system, yet that increases the survival by a third, according to the UK study with dexamethasone when they're at the end of their life on a ventilator in the ICU. I'm talking about using it as a targeted treatment in the lungs, and it, as opposed to a study comparing fluticasone, which is approved for asthma prevention, which increases the risk 3 times in certain populations for secondary bacterial pneumonia. Budesonide doesn't do that. And so that's why Oxford, NIH, Queensland University, Spain, and France are studying budesonide inhaled treatment against COVID.
Stay tuned for more after the short break.
You have 1 new message.
Dr. Bonatti, this is Norm Evans. I played for the Dolphins and the Seahawks. Anyway, I was just calling to say thank you to you again because I'm feeling great. No more back or neck problems after all these years, and I'm doing well thanks to you. I just wanted to say thank you and let you know I was thinking about you, and I always do. Okay, God bless you, friend. Keep up the good work.
Bonatti succeeds where others fail. Welcome back to American Medicine Today as we continue our discussion with Dr. Bartlett and his treatment for COVID-19.
One of the big, backlash, negative comments that came out when President Trump was touting hydroxychloroquine was that people were then going to their doctors and saying, can I get a prescription for this? Is this something that if people hear about budesonide, that they could go to their doctor just to be preemptive? Should they do that? Is that something that they should ask their doctor about because it has seemed so effective in treating COVID?
No one should interfere with a patient's relationship with their personal physician. But I have come across a solution that is effective, and I used it to help people breathe. It is FDA approved to help people breathe. And it just so coincidentally causes all the symptoms of COVID to resolve. And it also causes people to be symptom-free and have 2 negative tests. I think that's the definition of a cure for COVID. But I'm just calling it an effective treatment. And ask your doctor about inhaled budesonide if it's right for you. Ask your doctor if budesonide is right for you, is my answer. Budesonide is FDA approved for asthma. 25 million people in the United States have asthma. Some of those people, unfortunately, are getting COVID. Mm-hmm. And inhaled steroid is approved. Inhaled budesonide is approved for daily use as a preventive measure for asthma and inflammatory disease. If someone has asthma, I think it would not be a bad idea. As a matter of fact, it's FDA approved for prevention of asthma. Budesonide destroys COVID. And so even if someone's in the ICU on a ventilator, there's not a lot of downside to using inhaled budesonide compared to all the other things, including the risk of being on a ventilator.
Are nebulizers something the average person can purchase, and do they need a script for something like that?
You can get a nebulizer without a prescription, and you can even order it online. And many nebulizers are down to $34 brand new. And so they're not expensive anymore. There's many models. They just make a force of air when you put the tubing on there, so you can the contraption will nebulize the treatment, and they're inexpensive. Anybody can buy one without a prescription, but you have to ask your doctor about if inhaled budesonide is appropriate for you, and that's an individual decision. But I believe it's going to turn the tide in the United States.
Well, it certainly makes the outlook brighter, and it is not going to be what people are portraying as a death sentence anymore, especially if something that is inhaled so quickly has results virtually immediate. And like you said, depending on the individual case, it may take a few more doses, but you have treated your patients with 0% mortality rate. That is a cure. It sounds like a cure to me. I'm no doctor, but it sounds that way. The results are amazing.
You know, sometimes it can take weeks for people to recover, but as long as they're getting better and better and better and moving away from the edge of the cliff and zero mortality, that's my goal.
That's very good. That's very good.
Since January, we have been told that we need to shut down the country. We need to not go to the hospitals because of the concern that the hospitals will be overwhelmed. And this is a strategy that can be done as an outpatient strategy proactively in the early stages when people start to have symptoms so that the hospitals are not overwhelmed. I'm telling you, this is the way to keep the hospitals. This should be good news to the hospitals if they don't want to be overwhelmed. Now, if they want to be overwhelmed, this is bad news. But if you want to keep people healthy and out of the hospital, this is a winning strategy for my patients. And I believe, and there's many other providers using the same strategy, and they may be treating more people than I am at this time. At this point, their tally may be more patients than I am, and zero mortality for everyone that's using this strategy.
How many patients have you treated?
I'm going to say it was about 40 that I referred to other people yesterday, just in one day. And I've been flooded. And so I'm referring out to other providers who are using the same regimen, who are excellent. They're probably smarter than me. You probably want to talk to them as well. But at the end of the day, they may treat more COVID patients and have more numbers than I have. But here's my goal. Whether I see the patient or not, I want people to live. And that's why I got into medicine. And I'm not the only provider. We have a medical community. And we have an excellent healthcare system in the United States that has been hijacked for the last 6 months, where as opposed to the tried and true strategies for decades of early detection and early treatment has not been applied to COVID. We've actually been told, wait until you're a breath away from death. We've been told, if you come to the ER and you're severely ill, which is the strategy, you wait until you got severe symptoms, and then you get a positive test at the ER, you get to go home with Tylenol and tough it out. That's almost like, here, take a shot of this whiskey. That's the 1800s in West Texas, but I think we've advanced. Modern medicine has improved. We have more than one way to treat the flu these days, and I suspect we're going to have more than one successful way to treat COVID before this is over. But I'm submitting that we have a safe, effective treatment that is cost effective, that works, that's readily available at every pharmacy in America. And so we should not withhold this from the American people.
I think that's part of the Hippocratic Oath. When doctors are told to cause no harm, first do no harm, and you see some doctors speaking out against products like this that are life-saving, and I never understand it. Like you said, it should be available to the masses so they can protect themselves, and it shouldn't be a medication that is pushed down somebody's throat to take at a high cost. This has got to be something about not making money, but really caring about the United States and its citizens, and if these type of drugs can go to the other countries and infiltrate the sick, that's what we need to do.
Let the prize be human lives saved. Let that be the prize. I don't want people to make millions of dollars off a disaster. I think we need to do all we can, stand in the gap, and take care of American lives, and that should be the focus.
Well, thank you so much for the overwhelming success, Dr. Richard Bartlett, the man behind the discovery of Budesonide, which is normally used to treat asthma. It is having unbridled success against COVID-19. Thank you for being on the show and to promote this new finding.
Thank you very much for letting me spread the good news.
Let's stop politicizing the coronavirus and do right by its citizens and make it so that they have access to this life-saving drug. Thank you for watching American Medicine Today.